From the flu now to the measles, where we're also seeing the number of measles cases identified in outbreaks in West Texas and a nearby county in New Mexico jump to nearly 230. That's according to health officials in those states. The U.S. Centers for Disease Control and Prevention says measles cases have now been reported in at least 12 states. The majority are in western Texas and in New Mexico. Jen Sullivan reports on the growing concerns from health officials.
Measles cases have now been reported in at least a dozen states. As of Friday, more than 200 have been reported this year, according to the U.S. Centers for Disease Control and Prevention. In the West Texas outbreak, which accounts for the vast majority of cases, 39 have been reported in just 3 days.
The only way to stop an outbreak of measles is to prevent infections.
To prevent infections, health officials say more people need to get the measles, mumps, rubella vaccine. Typically, the first dose is given to children ages 12 to 15 months and is 93% effective. The second dose, given to kids between 4 and 6 years old, is about 97% effective, according to the CDC.
The MMR vaccine is one of the most effective vaccines we have against viral illness.
Dr. Wilson says the amount of misinformation surrounding vaccines has led to fewer people getting vaccinated, and that's how an outbreak starts. So far, 2 people have died, likely as a result from the measles. A school-age child in Texas and an adult in New Mexico. Both were unvaccinated.
We should be very alarmed. We haven't seen a death of a child from measles in over a decade in this country.
Measles is highly contagious. The disease causes a rash of red spots, fever, cough, and red watery eyes. It can cause serious illness and even death, especially in young children.
It is the most infectious human virus, more infectious than COVID, more infectious than HIV.
Jen Sullivan, WUSA 9.